my sister, Mademoiselle.
That is the most amazing introduction I have ever heard.
Oh, for being here. Oh, what an amazing day. Go make it even more amazing. Myself and Madison, Brian Wesley Johnson. Thank you for joining us on Saturday morning. Full of passion, purpose, and high quality living. See you next time. Hello and welcome to another edition of Soulivity Live, everyone. My name is Brian Wesley Johnson, and I am so glad you joined us because it's a fantastic Saturday and you picked the perfect moment to get inspired. Today, I'm joined by some wonderful people for a special health and wellness show developed just for you. But before I get into that, I want to once again thank our guest over the past week. Last Saturday, Soulivity show host D'Angelo Thompson, Javier Pedroza, and Candace Harper joined me for a no-holds-barred discussion about what's going on in our world. It was amazing and totally fun. Now, you can see these replays of all our shows by visiting our new and improved YouTube channel. Just go to youtube.com and search for Soulivity Magazine. Will pop up. Just subscribe while you're there and you will receive alerts and notifications every time we go live. So let's get into today's show, shall we? In today's world, we have been dealing with the crisis of COVID-19 earlier this year. This crisis has had a devastating effect on all of us around the world, but specifically here in the United States, it has been particularly traumatic. Starting back in late spring, there was a downward trend of the virus spreading. Things were really looking up. The country seemed to be moving in the right direction. But for many factors, which we will discuss today, the country is now in a deeper state of crisis. There has been a record number of new cases around the country, with associated record numbers of deaths. And it was recently announced that if the trends continue, we could see up to 300,000 people dying from this disease by the end of the year. The effects of this crisis are even more startling in communities of color. I mean, check this out.
As COVID-19 rages on, communities of color are getting hit the hardest and dying at higher rates than white Americans. Although COVID is more deadly for older people and more white Americans are in this age bracket, the mortality rate for Black Americans is still 3.7 times as high as that of white Americans. Latinos, Pacific Islanders, and Indigenous Americans have also been hit disproportionately harder. Undocumented immigrants likely have been too, but it is unknown how many have COVID-19 because many fear getting tested due to fears of deportation. Experts point to structural inequities like living in areas with underfunded schools and barriers to higher education that often lead to lower paying jobs. Many of these jobs are deemed essential, so they're out in their communities in higher numbers and unable to stay home. People from racial and ethnic minority groups are also more likely to live in multi-generational housing, making the virus easier to spread. About 1 in 5 American adults under age 65 are at higher risk for severe illness from COVID-19 due to underlying health problems. Yet these underlying health issues are more common in communities of color. These groups are also less likely to have health insurance. Even for those that do have health care, lack of transportation, childcare, language differences, and discrimination in healthcare systems sometimes prevents them from seeking care. Some studies also show that discrimination and racism in daily life can lead to chronic and toxic stress that increases the vulnerability to infectious diseases like COVID-19. People of color also tend to live in more communities that are adjacent to plants and factories that emit air pollution, making them more susceptible to asthma and hypertension, which increases the risk of death from COVID-19.
Hey, thanks for watching. If you like this video, check out.
Now, I say all of these things to you in an honest attempt to bring some truth to where we currently exist. And that our goal today is not to make you feel bad about what's happening, but to make you aware of certain facts and information you may not have heard, but also give you additional tools and perhaps even resources to help you move through this time with more peace, more comfort, and more wellness. Well, we have several guests today that I want to introduce you to, but our first guest really doesn't need introduction, but let's learn a little bit more about her first. As a young girl in Little Africa, South Carolina, Ebony Jade Hilton declared at age 8 that she wanted to become a doctor. From that day on, her mother called her Dr. Hilton. Today, she is a doctor and professor of anesthesiology, the medical director of a consultancy, an author, and a lifelong advocate of America's underserved and marginalized communities. Dr. Hilton's passions continue to explore the issue of health disparities, particularly as it pertains to race, and bridging the gap between physicians and the communities they serve. Her works have led her to integration in the medical school curriculum and have taken her across the globe to participate in numerous medical mission trips via Project Dakari at Bugando Medical Center in Mwanza, Tanzania. Dr. Hilton's efforts have been recognized by the National Medical Association and the National Minority Quality Forum, which named her one of the top 40 under 40 leaders in healthcare. In addition to pioneering medicine, Dr. Hilton is the author of the AVA series of children's books, which focus on the power of positive thinking.
Six months pregnant when she went into a clinic to get her prenatal care. And they performed some tests that she's still not exactly sure what tests they were doing, but she started to leak fluid. And she went home and they told her everything is fine, don't worry about it. A couple of days later, she actually went into labor, and he only lived for 3 days before passing away. So that was my first introduction to medicine. And
Wow.
yeah, and my mom was the keystone of our family. And so seeing her, upset this many years later, I didn't know as a child how to really understand those emotions, but I knew that I wanted to do something to make sure no other mother would have to feel that way. And so
Wow.
yeah, that was it.
Wow.
8 years old. Yeah.
Wow. And I mean, your mother started calling you Dr. Hilton.
Mm-hmm. Yeah, she would sign my birthday cards. She would introduce me to people as Dr. Hilton. And I think I was crazy enough to actually, like, legit, I thought I was a doctor. My little sister was always into something. And I would make her Band-Aids. I would diagnose her with stuff. I think she's had every diagnosis in the book. No, but it was really one of those things of she told me I was. And so I had no plan B. It was, okay, that's exactly who I am. And so, yeah. It's been
Wow. What was it like for you to have, I mean, your mom was your biggest cheerleader. I mean, what was it like for you?
Right.
I mean, you knew, you went through this tragedy, you knew what you wanted to do. And at the same time, there was going to be these challenges coming along. I'm sure she was with you every step of the way, right?
Right. And my two sisters and my father as well. It's one of those situations. I grew up in a neighborhood, a single parent home. There were no doctors, lawyers. That wasn't around. But it was one of those things of, in seeing, even as a young kid, I recognized the inequalities that existed within even the educational system. For instance, when I was in the second grade, one of the standardized tests, I placed, I guess, high. And so what they would literally do is take me as well as I think 3 other classmates and take us on a bus every morning. We would leave my elementary school and get bused to another school where I would take science, math, and English. And then I would get bused back to my elementary school to take art and PE. And you know, we were learning algebra in the second grade with this pawns and cubes. And I remember thinking at that time, like, I know my classmates at my real elementary school, they can do this. So I would try to teach them what we've learned because it was so exciting. So even as a child, I knew that something is not right. Why do I have to leave my school to get taught something somewhere else? And so it's now a big push for me to say, how do we make things equal so that we're not having 2 different zip codes with two different setups for success and or failure. So yeah.
Well, I mean, I've watched you on so many different news agencies, and you're talking about, you know, your advocacy in terms of health disparities and that kind of thing. It's so empowering. So thank you for doing the work that you're doing, because it's absolutely necessary. I mean, we're going to get into a little bit later in the show some specifics around how this whole crisis is affecting different communities differently. Mm-hmm. But I first want to add, my first question to you is, you know, the crisis here is just, we are doing so bad. I mean, by any measure, mm-hmm. regardless of what some people are saying, which I will not mention their names because we just don't do.
Oh. That you told me, because
unless you want to, you know, right. I mean, you know, we try to stay apolitical, but at the same time, there's sometimes where just truth and honesty, the facts are the facts.
Right.
By any measure, by any slope, every country has had a bump and it's gone down. Mm-hmm. America had a bump, it seemed to be going down, and then it went back up again. Mm-hmm. Why are we doing so poorly?
Right. And I'd like to remind people, we're very much still on the first wave of this. So the reason why we saw the slight downward trend, if you look at it, those numbers were all based on one city, New York City. We were having deaths of 1,000 people a day dying in New York City alone, right? And so when New York City finally, unfortunately, when so many people had passed away, and that meant that everyone now in New York City started to take this actually really, really seriously, they locked themselves up in their homes and allowed this virus to stop its spread. As a matter of fact, right now, New York has a positivity. So the number of tests that they're giving versus the number that come back positive is less than 1%, which is fantastic. We want it to be at least less than, if we can get it below 4%, that's when we say that your city actually has it contained, your area has it under control. Under control, meaning there's still some people that's positive, which is not great, because every person that's infected is someone's son or daughter at bare minimum. But that at least we have enough resources around as far as the healthcare system that we're not completely overwhelmed. So when we saw that gradual decline, it was only because New York City was now being the captain of that ship for themselves. As far as the rest of the nation in each small city of South Carolina and Florida and Georgia, their numbers were going up. But, and so there was this false sense of, oh, things are getting better. No, that's not true. And now what we're seeing is the result of that. And those little small embers that were planted in the deep South have now turned into huge flame. And I'm sorry if you can see my dog. But
no problem. But, I'm still waiting for my cat to kind of like walk down here. So it's all right.
Right.
They want to get into the conversation.
Right. But those small embers have now turned into massive forest fires. And we see how far behind this 8 ball we truly are as a nation. And we can put our head in the sand if we want to. But at the end of the day, people are dying, and we're dying in very high numbers. The comparisons are just not there for any other disease process that we've seen, at least in the last century.
Wow. You know, in the medical community, I mean, you guys are our front line.
Mhm.
And we love and appreciate you so much.
Can I say something about that?
Absolutely.
I feel guilty every time I hear that. Only reason being is that, and yes, and everyone in the medical community will say we greatly appreciate that recognition. We're trained to do this, which, and it doesn't make it any better or any easier. We know that we have physicians that are dying. We know we have nurses that are dying, respiratory therapists that are dying. We have EMT and firemen and paramedics that are dying. So I don't want to belittle that at all. But there are a number of frontline workers that also I think deserve just as much prestige behind that. And they're the grocery store workers, the custodial staff that's helping to clean up,
Absolutely.
The hospital, the firemen, and now we're adding on to that also the teachers that are also going to be on the front line of this. My little sister's a principal, so I have to make sure I point them out. but there's with this pandemic, we're seeing that there are many frontline workers that have never been trained to be frontline workers in the medical arena. And so I just want to make sure that they
Absolutely. I mean, that's an important point. Specifically in your community, though, there's got to be tremendous strain with personnel, and I mean the number of hours. I mean, yes, I know you guys are trained. I mean, I have friends that are doctors. You're trained to work long hours, not like this, not under these circumstances where you're literally working like in a CDC quarantine kind of situation where you're having to wear PPE and go through that process every single morning and coming home, and if you can get home within a reasonable time. Tell me a little bit how that experience is.
Yeah, I mean, to tell you the truth, and it's one of those things of where you don't see the bullet coming, right? Literally every person that you meet can potentially be a spreader of this virus, and so you don't get a reprieve, you don't get a rest to be able to say, okay, I can let my guard down right now. And so you're constantly on. And to be honest with you, in the very beginning, I think it was like mid-March, I was gearing up to go into the ICU that morning, and I just sat in my car and I just cried, and I was like, okay, how do I get myself ready for this reality of what life could be for me when you're thinking about ventilators. And so I went home that day and I called my family and I said, I've created my will. Here it is. These are my directives. Let's talk about what do we do in end of life situations, and let's go through as a family too. What would you want me to do for you? And so we had that very real conversation. That I feel like the majority of, well, all the doctors I know and the nurses I've spoken to about it, we've all done that same thing, regardless if you're 30 years old or you're 60 years old, just because the more likely we are to be exposed to it, given that we're in the hospital. So, yeah. It's more of a mental exhaustion. Unfortunately, medicine, especially for physicians, because we don't have work hours. We don't clock in or clock out. We literally are you're just there. So you're used to working, 60 to 110 hours a week is your normal work week as far as your hours. And so your body gets used to a certain amount of wear and tear, but I think the emotional burden of this one is just different in that the exposure comes from simply breathing, and I can't stop that. Wow. So, yeah.
Ebony, what do we need to do? I mean, what do we literally need to do to move out of this? I mean, what are some of the best practices that other countries have demonstrated, even though they might have flare-ups, they still have been able to maintain this downward 2-week trajectory of cases? What do we need to do?
Right. The best example for that will be South Korea. I mean, I think 5 million or so. I'm not sure exactly their population size, but they've had in the hundreds, like 300. And again, I say for every one person who has died, that is a huge number. And I would never say, oh, it's just one person, because that was someone's complete world. But they fortunately were able to limit the sheer impact that it's had on their entire population. So we can look at South Korea, but if we wanted to even look just closer to home, literally look at what New York City did. Okay. They had a rampant increase in the amount of cases. They had a huge, huge death loss. And when it finally sunk in that this thing is real, unfortunately, again, once that forest fire starts, it's hard to stop it. But what they did to stop it and to at least slow it down was shut everything down. So instead of you walking out of your Manhattan apartment and seeing 200, 300 people on the sidewalks, you saw maybe 2 or 3, right? And unfortunately, as much as America, wants to protest this happening, we have to shut down. And it's not a shutdown kind of, sort of, where we kind of want to still be able to go out and enjoy Baskin Robbins, of which I do enjoy,
Right.
But we can't do that. And if we truly as a nation did that for let's just say a solid month, one solid month of where you only went out for emergencies, you only went out to go to the grocery, naturally get the groceries delivered. If we did that, we could beat this thing. But we have too many egos and too many, side interests to actually band together to say this is what's best for all of us. And unfortunately, that's going to cost us, estimates of upwards of 300,000 to 1.7 million people dying before we actually have an effective vaccine and treatment.
I mean, because I think gosh, I'm loving this.
Mm-hmm.
In the way that you're laying out the pure information that I think these are some things that people didn't know, like the difference between the bump was New York. It wasn't the whole country, right? The fact that other countries have already demonstrated what to do. I mean, in Europe, for example, as well, right? They shut the country down. They shut whole communities down. They're still doing that in Spain and in Germany. If they have a pop-up, they say, oh, we're going to quarantine. Everybody's at home. Contact tracing, testing, right? This is affecting communities of color differently. This has been a horrific experience in our communities that is different. Tell us a little bit about that as well.
Right. So when we're looking at racially, so Black and brown communities, I just say it that way. We have to think of 2 different pillars of where we're having our insult. One is we're more likely to be infected, and then the second one is we're more likely to die. Now, why are we more likely to be infected, right? So if you think about, again, the way we get this is just exposure. So whereas where the rest of the country, when we were able to lock down for those handful of weeks that people were kind of participating with that, we know that the Black and brown people make up the bulk of what we call the essential workers. Now, these people, for the last decade to 2 to 3 decades, have been protesting for a livable wage, but now they were all of a sudden tasked with having to keep the entire nation afloat, right? So they were the farmers. They were the ones keeping the food supply chain open. They were the grocery store workers. Again, they're the ones that basically, if they weren't there, our economy right now would be in shambles, regardless if the Federal Reserve wants to dump trillions of dollars into it or not. But those Black and brown people had to show out in force, and other lower socioeconomic status individuals. Now, when they went out into their jobs, they picked up the virus from each other. They weren't allowed to protect themselves. And then they traveled back to their homes where they tend to live in high density populations. That's where I grew up, right? Where people are kind of stacked on top of each other. And so that's the perfect breeding ground for COVID-19 to fester and to spread itself amongst that community group. Now you take that low paying job, and we know that for example, only 1 in every 5 African Americans can actually work remotely from home. Only 1 in every 6 Hispanic Americans can work remotely from home, and 20% of those individuals don't have health insurance at all. So as far as their ability to afford healthcare access is limited too, right? So you take all that, that's what makes them more likely to be infected in the first place. And then the point of being more likely to die, then you have to look at what we constantly say in the news is, oh, it's the elderly and those with pre-existing conditions. And that little asterisk besides pre-existing condition is what's going to be the, what do you call it, the Achilles heel of the Black and brown community, because we know based on necropolitics of the influence of policies that directly impact negatively on your health and on your life experience, they target Black, brown, and lower income neighborhoods. It's just what it is. And so when you're looking at, for instance, redlining and how we have back in the 1930s, this principle of we're going to have a map and we're going to say where Black and brown people can live. And we're going to put industries there that spew toxins within the air and water, like we have with Flint, Michigan, right? What does that do as far as these pollutants to the development of chronic lung disease like asthma and other chronic lung illnesses? And if you get COVID on top of lung injury, it's a setup for death. Same thing for heart disease, hypertension, diabetes. If your neighborhood doesn't have a grocery store or doesn't have any healthy food options, and it's only Burger King, McDonald's, and Taco Bell's that's allowed to plant themselves within your community, this high sodium, high salt, high sugar diet leads to diabetes, to hypertension, to heart failure. And unfortunately, those people tend to die at higher rates from COVID-19. And so Black and brown people, with the systemic racism that has kind of existed since literally 1619 when it comes to the management of our citizens, it's been a setup for us to have worse outcomes from the very beginning. So,
well, all of that makes sense. I mean, I know my own history. I know the knowledge, education that I've had around the communities of color. But even just hearing, if you hear it for the first time, everyone, I mean, it makes sense, right? People who've had lack of resources and lack to higher technology jobs like remote work, right? Where it's skilled labor, where you don't get paid if you don't go in,
right.
You will be more susceptible to disease if you go in and work, right?
Right. And even if you look at when we're talking about the high risk populations, you can't talk about prisons without talking about social injustices that happen in locking up of Black and brown people at higher rates. Yes. And now we're getting into the era of opening up schools, right? And those are now going to be vulnerable populations because we know our children are getting infected and we know our children are dying at higher rates. And the idea that we know that schools get their funding from federal and local dollars, and that the local dollars are 80% of that comes from property taxes. Well, again, if you have poor people, they can't afford to buy a house, which means their property taxes are non-existent, which means that school is underfunded, which means it's going to be overcrowded, under-resourced, and the breeding ground again for COVID-19 to spread within the walls of where you cannot socially distance. So this is definitely a targeted impact, and it's something that we can't be silent about anymore.
Absolutely. So. We're going to talk a little bit about that in the last segment as well. Ebony, thank you. Thank you for being here. We're going to, everyone, we're going to bring Ebony back in our last segment when we do our little round table, when we're talking a little bit more in depth around how do we move as a community together, both in communities of color and the majority. How do we move together out of this? Ebony, thanks again.
Thank you so
much for
much.
being here. I loving this. I mean, loving the information. Everyone, this is what it's all about. It's all about giving you the facts and the information that you need right now in the midst of this crisis so that we all can make a turn and perhaps get out of this quicker than what's projected and stop the number of deaths that's happening. So we're going to take a quick commercial break, and when we come back, we're going to be talking with our next guest. We're going to talk about the psychological effects of what's happening with COVID. So stay tuned. We'll be back.
Have you ever asked the question, if I was to be anything, what would I be? Regardless of money, regardless of status, beyond popularity and fame. Living your passion, feeling your life has purpose. Soulivity is a space to nurture that which lives in all of us. A place where work can become play, and doing what we love creates the dreams of a lifetime.
All right, we are back with Soulivity Live. I want to make sure that we show you a little bit more about our next guest. So, little video. Jesse and Melva Johnson have over 60 years combined experience as psychotherapists, relationship educators, workshop leaders, public speakers, authors, and consultants. Melva holds a master's degree in social work from the University of Michigan and is a certified Imago relationship therapist, workshop presenter, and consultant. Jesse holds a master's degree in humanistic and clinical psychology from the Michigan Graduate School of Professional Psychology and is also a certified Imago relationship therapist and consultant. Through the study of marriage and family therapies, marriage education programs, trial and error, and an ongoing shared commitment, continuous dialogue, problem solving, goal setting, planning, cooperation, and mutual support, they have successfully created the kind of marriage, family, and professional life they desire. They are also the authors of Mining for Gold in Your Marriage, the 12-step journey to uncover the hidden treasures in your marriage. They have also appeared on local and national radio and television shows and have been featured in numerous print media. So it is my pleasure to welcome to Soulivity Live, Miss Melva Thomas Johnson. Hey, Mom, how you doing?
Hey.
That's the secret, y'all. If you haven't watched their show Live with Melva and Jesse, you didn't know that this is my mother. Love her so dearly. But more importantly for today's show, I wanted to bring her on to talk about the psychological effects of the crisis. Mom, you've had many years, even though you're so young, so many years of experience dealing with having clients that have all these different types of challenges in their life. This is different, right? And with all the educational experience and professional experience that you have, really wanted to get your opinion on what do we need to do? What are some, not what do we need to do, but more so, what are some of the signs that you're seeing even with your clients that are happening right now in terms of the...
I see a lot of acting out, a lot of acting out because people are terrorized. And it first shows up as anger, because when you're living with something that you don't have any control over, and you already have other things in your life that's not working, and your foundation is not solid, what we see mostly, and I'm talking for both of us, what we see mostly, and people come in, because they're angry about this or that or the other. But when you peel away those layers beneath the surface, they're hurting and they are scared. And it also presents as depression, anxiety. People try to talk to each other and then they're yelling at each other. I mean, somebody could leave the top off the toothpaste and that becomes like a big issue. People, they can't find peace. They just can't find peace.
So I heard anger, I heard anxiety, I heard fear.
Depression.
How do these things manifest themselves physically in the relationship? Are there more fights? Is there more distancing? What are some of the things that are going on? I really want to make sure that our audience understands from their perspective, okay, I'm here at home, I'm under the stay-at-home order. Oh, maybe, wow, I may have to be more self-aware, right, around what's going on. So I want to get some more specific. How does this stuff manifest?
Well, there's a mixture of arguments, and then there's that silent, there's that painful silence. Because when people get tired of arguing, then they just stop talking. But they have this wedge between them, nothing gets resolved. It's hard for people to be present with each other because they have so much turmoil going on inside. And if they have an opportunity to share their experience and acknowledge the pain that they're going through, the whole conversation changes, the whole dynamic changes. Because when a person finds themselves being angry all the time, and there's a lot to be angry about, in addition to this virus, when people can really talk to the people that they care about and just share their experience, there's a 3-point part thing that we do in our work that's universal. To be able to share your experience with someone, especially someone that you care about, and to have that person validate you, meaning let you know that they understand your journey and where you are in your journey and the pain, and just be with you in a compassionate way and imagining what that's like for you. When your conversation has that kind of foundation, then you start feeling support, and then you can get to a mindset and a space where you can focus on, this is the hand that's been dealt. How are we going to play this? How are we going to, if it's a couple, how are we going to play this in partnership? Family, how are we going to play this hand as a family? It's like we have minimum resources to deal with it. How are we going to pull what we have in a way that we can navigate through this?
Wow. Are the same things happening with children that have you seen in your practice in terms of like children exhibiting the same types of symptoms?
Well, I mostly see couples, so I don't see their children, but what I tell the couples that I work with, that we work with, is that the parents have to get it together, whether they are together or not. They have to create a safe environment, a safe emotional environment to protect those kids, to nurture those kids, to hold those kids, because they don't have the skill set to do it on their own. And so if they have the mindset that we're going to work together through this, I mean, as a history, our culture, as a history, we have learned, we've done this before. I mean, our heritage is based on coming together through horrific times. And this is one of those times. And so one thing that you don't have to pay for is emotional support. That is free. That is free. And if we can do that in a generous way, it just helps to navigate the journey a little better, and to look at what we have to work with and maximize it. I mean, I remember, growing up, that there was so many ways, so many people in my life, including my parents, they knew how to stretch $1. I mean, we have that kind of history. So we know we can use that idea to stretch whatever energy that we have inside to be together, to work together, to navigate through this. At some point, we're going to get on the other side of it. There's two questions. One is, what kind of person are we going to be as a result of how we navigate it? And number two, how are we going to deal with the losses along the way? Because so many people are dying, so many people are ill. It's like, how do we navigate all of that? And a lot of people, which is great, they have their spiritual resources to fall back on as well, to support them, to get it figured out, how to navigate this part of the journey.
You know, Mom, it sounds like this is an opportunity.
Mhm.
This is an opportunity. I mean, in the midst of crisis, I mean, you talked about our history in terms of communities of color, where we've had to move through stuff, figure it out, right? And it sounds like this is an opportunity for us within communities of color, but the whole country as a whole, to take this time to strengthen our relationships, to strengthen how we support each other. Is that kind of like, I'm getting this sense from you, is that kind of like where you're trying to go with this as well?
Yes, yes. And it's strengthening our own foundation too, because, you know, the whole idea that it's better to give than to receive, well, the giving does grow a part of us in terms of how we show up. We want to show up as best we can to weather the storm. So individually, it's important for everybody to take care of themselves from the inside out so that they fill up their cup. I always use that as a metaphor. That is hard to, if you're giving from an empty cup, then you're going to be sicker because you're going to be stressed out and what have you. You got to take care of yourself. You have to do whatever rituals that support you, that uplift you, that inspire you, that strengthens you. And then from that place, decide, how am I going to be in partnership in this situation with whomever? And on a day-to-day basis, it's just so easy to get on each other's nerves. I mean, I love Jesse. We can get on each other's nerves, you know?
It's true, y'all. They do get on each other's nerves.
And we can talk, you know, we can talk about it, you know, so, and, you know, thank God getting on each other's nerves doesn't last for 5 years at a time. You know, it's like, oh, you just got on my nerves, talking through, move on. So for people to be able to, you know, to do that, because, you know, we have, when there's upset looming and people are flooded with feelings, it's like all of their problem solving skills are on the back burner. Everything they love about the other person is out of view. It's on the back burner. So if people can be focused and be intentional and decide on a day-to-day basis how I'm going to show up so that I am in good shape to be in partnership, to be a team player, I think it makes a difference.
I love that. I love it. I love it. I wanted, you know, Ebony kind of talked about a little bit earlier about the effects of how this is affecting our school systems, the educational system. You and Dad have been educated for a long time. Motivational therapist now, but education is very, very close to your heart. It still is. What are your thoughts about, like, you know, the psychological strain that the current openings are having on, you know, our teachers, our students, the support staff, as well as the thoughts about what may occur in other larger districts like New York is about to open? You know, what would be some of the psychological strains that may happen? Is it similar to what the family dynamic that you were talking about before?
Yeah, I mean, it's devastating. Jesse and I were talking just the other day. We were saying that we're so happy that you and Paul are not in school right now and that we're not in the school system right now, because absolutely we would not be going because we care that much about living. I mean, unless the system had a guaranteed way of proving to us that everything was safe, and you and Paul absolutely would not be going. And
We appreciate that.
And if we were not in a situation where if we didn't have computers and what have you for online learning, which is prevalent in so many of our communities, again, going back to being resourceful. I mean, because there's so many people, you know, I think about the community groups, like when we were in the school system, we did a lot of school community relations. And there were a lot of community groups that showed up and provided resources for people. And so if there were no computers available, there would be resources in the community that would support children to have that learning.
You know, so, go ahead, sorry.
Yes, so even without having Google, people go to church and they can talk to each other and find out about resources there. People have friends that they can talk to and just kind of brainstorm about resources that they have, you know, because I don't want to think that there's no way out. I mean, right now, the only way out is to stay safe.
See, yeah, you know, on that note, I'm going to bring Ebony back in on for this because safe, right? I was an educator as well for many years. The number one thing for student to, you know, in terms of the environment for them to learn, that they have to feel safe. Mm-hmm. Then you build on that. So Ebony, tell us about the medical challenges. From the medical perspective, what are the challenges in reopening our school?
Yeah. Well, I've always said I think teachers they are saints. None of us would be what we are if it weren't for a teacher actually teaching us how to be. So I think they don't get as much credit as they definitely deserve. But the things that would keep kids safe are the same things that would keep, you know, adults safe, which are going to be wearing masks, distancing these children from each other, limiting any contact they have with shared materials such as books, pencils, even just space, toys, you know, things that I don't know how you keep a 3, 4, 5, even 7, 8-year-old from wanting to interact with each other. We know that we are social creatures. Yeah, that's going to be, you know, a challenge. And it really is one of those things where we know this virus kills, but so does poverty. And as your mom beautifully stated, you know, 20% of children in South Carolina don't have Wi-Fi access at home. We know that education is key, it's important. And we oftentimes do rely on community to fill that gap. But this is where I really challenge the nation to say we have to hold some elected officials accountable on the federal, state, local level to say that we pay taxes every day. I mean, even if you don't pay income taxes, you go to the grocery store and pay sales tax, you pay money every day. And there should be some accountability of taking care of your citizens and people who are contributing to the society, and children are included in that number. So.
Absolutely. What do you think about that, Mom?
Yeah, I agree with that. And part of the safety, the emotional safety, one thing I would recommend as well is what we did as a family. We did, and this is absolutely free, every week. I mean, every week. And we even did it a little bit after you and Paul grew up and moved out of the home into your own lives. We had weekly family support meetings, where we had a dedicated time where we would sit down together, face to face, eye to eye, and connect. And everybody had an opportunity to talk about their experiences. They got a chance to talk about what they were feeling good about. They got a chance to talk about what they felt stressed about. They got a chance to ask for support. And everybody had Since it was 4 of us, everybody had 15 minutes, but sometimes people needed more than 15 minutes, which was fine, But nobody could talk during anybody else's time. We were just there to hold each other in love and care. And I think this creates safety too. Because we want to protect ourselves, we want to protect each other on all levels, and to have a way that you can, that you can go to a place and just be yourself and open up your heart and have people be there for you and hear you out, lift you up, makes a big, big difference. I would like to see that happen in more families.
Yeah, I think it's a positive thing. I'm also appreciative that you didn't tell our business. Yeah, there were certain things that we talked about, but it was, it's. I think you're right, Mom. I think it's an important part of this, right? You were talking before about families coming together, being united, right? And so, how do you do that? That's one mechanism to do that.
And a daily check-in. When the day starts and at the end of the day, because these feelings, they're simmering beneath the surface all the time. And when they can be addressed and you can say something about it, then you have less angry outbursts.
Right.
Because you're kind of neutralizing the intensity of it.
Ebony, how do you deal with the sheer stress of everything that's happening right now? I want to ask you this question because I think it's important for maybe there's something that you can give to other people around this, because you're I know you said you cried earlier when you were in your car. That's one way to do it, right? Where you get that space. What are some of the other ways that you've been doing to give you that self-care?
Right. And to be honest with you, I'm probably not the best person to ask about self-care because honestly, the way I cope is by doing. And so I've been very busy here of late. This last few months have seemed to go by really quickly, because if it's not doing an interview, it's doing a community testing event, it's doing a children's book. But it is one of those things of, that's the way I personally cope, is when I see a problem, my initial thought is, how can I be a part of the solution? Okay. But to be honest, kids are my soft spot. And this whole thought of reopening schools really does hit me in a different place, because I know that, with kids, school is school. Yes, for them to be educated. But what we know is that, again, poverty kills. And we know a large percentage of children, unfortunately, their only meal comes from school. What we know is that, unfortunately, some children are in some pretty unsafe environments, of where, again, teachers, being those saints, are the safeguard between abuse and getting someone to intervene. And that's not happening at this point. We know that, there's going to be a lot of things that are going to be missed that can impact that child's life for the longevity. And that's where I have a difficult time, because I don't know how to solve that problem. And I literally called my sister, who's, again, a principal, to say, what can we do? And what can I do to kind of help to shed light on that? And that's, again, where I say, I get really political when I say we have to start calling things out and say, how do we get resources to these communities that are going to be at great need, to give them the resources they need.
Absolutely. Speaking of resources, for each of you, I always want to give our audience, our viewers, something to take away, right? As I said on the top of the show, this isn't just about giving information. I think the information that the both of you are giving is totally awesome. We need to hear it, even if it's hard for us to hear. Need to hear it so that we can make better decisions. Mom used to talk about, know better, you do better, right? And so, for each of you, what are one or two things that our viewers can start today that will move the ball forward to us getting past this thing? And Mom, I'll go to you first.
I think the first thing is to acknowledge the pain, because this is really painful. When I go out, you know, I wear the mask and what have you. But there are times when I look around and just see the situation that we're in, and I start crying. It's like our lives have come to this, you know, so I would say acknowledge it. And number two, acknowledge it to yourself, and to make sure that you can share your experience with someone else. The third one is be open to being safe and protected, and safe and protecting in all levels of all of this, at home, at the grocery store, everywhere. And I do believe that we're going to get on the other side of this, and we can take a look at, when we get on the other side, the person that we became more of.
Thank you for that. Ebony, how about you? What are some things that, that 2 or 3 things that people can do today?
Right. Well, that was nice. My thought is that, you know, this too shall pass, and to really rely on your inner peace, but also know to give people grace, because, you know, we wrote a children's book saying we're going to be okay. But we know is that, unfortunately, at this point, 165,000 people have died. And some of those are someone's mother and father, and they may be a tiny little kid, and their life will never be what it was ever again. And the grief process that that people go through may express itself in different ways, and that we have to start thinking more so on the scale of what's best for my community. And when I say community, I mean literally our global community at this point, but definitely the community in which you live and reside. How do I do things that might make me feel uncomfortable? You know, you see people say, well, I can't breathe in this mask. Okay, then maybe you only need to go out to the grocery store for 15 minutes, and maybe you don't need to walk through the mall casually, right? Because it's literally costing people their lives. And for some people, seeing other people without a mask on now is a very big trigger for them, because if they have lost a family member, if they have lost a sibling who they had to see their final days not being able to breathe, and they see someone taking that kind of lightly in their grief process, it may hit them in a spot that they didn't even know was still very much sensitive for them. So I think point 1, 2, and 3 for me would be to think outside of self. And honestly, if we can band together as a nation, we can get through this. We will never be the same. We will never look the same. And maybe that's a good thing in some ways, because maybe this will force us to start thinking literally as the United States of America, and not as our individual pockets of whatever privilege we decide to hold on to for that moment in time. So,
wow, thank you both.
Yeah.
This has been awesome. This is exactly what I wanted to give our audience today. Just make, you know, again, as I said before, you know, when you know better, you do better. And this is what this show is all about, in terms of especially this crisis. And we did a show 4 months ago about how to cope during the crisis. 4 months ago. So we you know, that's everyone, that's where we are. And so we had to revisit this, had to talk about it again. And I had the best and brightest here with me. So thank you both for being here. Hang on 1 second while I tell some folks about some exciting stuff that we're doing. Everybody, for the last few weeks on Soulivity Live, I've been talking about our exciting new collaboration with Beyond Words Publishing. And we're doing giveaways. So you want to make sure that you are watching our social media. I mean, we're giving away great gifts like Paul O'Brien's I Ching Visionary cards. We're giving away the new books from Madison Taylor, Unmedicated, and Why Worry by Catherine Tristan. So you want to make sure you go to our social media to make sure that you can see what we're doing. Now, specifically, if you want to win something, you must sign up for our book club, Inspiration Central. Just go to our Facebook group, Soulivity Magazine Book Club, and you could have a chance to win. Also, don't forget to check out Soulivity TV, available 24 hours a day, 7 days a week for your inspiration. And coming up tomorrow, we have morning yoga with Michaela at noon and live with Jesse and Melva at 5:30, both times Eastern. Of course, you want to check our website for more information. So yeah, you'll get to see this gorgeous creature up to my right here. We'll be talking about some great things. Mom, what are you guys going to be talking about tomorrow?
We're continuing our series about betrayal, how to deal with it, how to overcome it.
Oh man, it is fabulous. You know, I know, yeah, I'm producing it, but still, it's great. This is what, number 5 or 6 in the series?
Number 6.
6. I think it's 6. So there's 5 episodes before. If you haven't seen them, make sure you go and watch them on our YouTube channel. Ebony, what's going on? I mean, I want to make sure that we're plugging you too. What's happening next for you?
Yeah, so I have a medical consulting firm, Good Stock Consulting, and we have a podcast called The B Word Unpacked. We're on YouTube as well under Good Stock Consulting. So we are releasing a brand new series on breaking bread, of where we're talking about anything race relation. But we talk about a range of things from, medical things, yes, but really just life experiences and everything that comes along with being a minority in a majority country, and how do we navigate the system? How do we make it better for us in our community? And promoting things that are good, innately good about our community and making it better. So.
Fantastic. See, moving on up.
Right.
Moving us on up, both of you. So
right.
Listen, everybody, we're out of time, but I wanted to say on behalf of Melva and Ebony, thank you for joining us on Soulivity Live. Can't wait to our next show together. Of course, as always, I'm wishing you passion, purpose, and high quality living. See you later. Bye-bye. Soulivity Magazine brings you the best in inspiration on Soulivity TV. Check out our new shows. Mark your calendars for Soulivity Magazine shows by going